The following is a paid program and does not necessarily reflect the opinions of the staff or management of Visionary Related Entertainment.
Softer and softer it gets. I think it's gone. It's gone. We're on. Aloha and welcome to Maui Nonprofit Notes. Now in our 10th year of broadcasting each week, we continue talking story with Maui's nonprofit executive directors and staff to find out how they're working to support those with needs within our community. Maui Nonprofit Notes is generously sponsored by Pacific Source. If you're building or remodeling a home, please stop by Pacific Source's cabinet and appliance showroom located in the Waikapu Bay Shard. I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host for Maui Nonprofit Notes. During this hour, we're going to share some of the experiences of our nonprofit agencies and just how they're changing lives, changing communities, and creating miracles of hope for those with needs. Today, we're going to start off the show talking with a couple of folks from Maui United Way. And one of those folks is somebody, you're still pretty new, aren't you?
I would say very, very green.
What,
and
4 months?
Has it been that long? It feels like 4 years, though. I will say that.
Is that a good thing?
Yes and no. Talk to me in 5 minutes.
Oh, okay. Gotcha. Well, you sure have jumped in. And we're talking with Nicholas Winfrey here, who's the President and Chief Professional Officer for Maui United Way. And I think you were on the show the first day you were at work.
Third day.
Oh, third day.
Yeah, I was already running.
Oh, you already knew what it was all about.
Yeah, let me tell you.
Very good. Well, we've seen some of the changes that you've made already, and some of them are pretty dynamic. I think the more exposure on things on the social media for all of your partners. I think that's great.
Well, I can't say I in that instance. I think it's really the staff and the continuity of staff that's been at Maui United Way for such a dynamic period of time that, it's really them stepping up and taking charge in that space. And of course, if you get to brag about the partners and the work that they do, how can you say no to that? So it's great to see. And for me personally, selfishly, it's great to learn about the great work that they're doing.
Cool. That's what I like. Somebody who shares the compliments.
If you knew how much I didn't do, and how much they do, you would understand why I got to keep them happy as well.
Oh, okay. There's more you could say, I take it.
It is. I'll say McConna and Angela, who we've got with us today, as well as our new office manager as well, really have taken the bull by the horns. And to see the work that they've done and the foundation that they've built over the past, combined decade here at Maui United Way. It's really incredible to see. So for me, I always say just be patient. Let me be a sponge. Let me absorb, because I got a lot to learn from them, and learning I am. So thank you. I'm looking at Angela now. If you guys can't see on the radio.
And we do have Angela. What's your position over there? I forget.
I'm the campaign and projects coordinator.
Okay, that's of course why you're here, because you just kicked off the campaign for this year.
Yes, we did. Our campaign actually starts on September 1st, but since that's a Sunday and then Monday's a holiday, it's going to be the 3rd. So what we've done is we've already put together all of our campaign packets. Our campaign packets go out to approximately 300 businesses here on Maui and a couple on Oahu where they have their corporate offices. And we had a volunteer opportunity to come and help put these packets together. We had about 12 people that came out, and normally what takes me a day and a half, we did it in 90 minutes.
Wow.
It was awesome. It was so great seeing the volunteers out there and putting the packets together and seeing what goes in the packet. And it's, the pledge forms, the report to donors, things that inform everybody what we're doing here on Maui. So, and it's good to have the volunteers come out and do that. And,
right.
Yeah.
And I think just so everybody listening understands, the Maui United Way campaign that we do every year, this is really our biggest fundraising push. So this gets all of our community partners, our corporate partners, and our business leaders to come together and help fundraise for all of our partners. And those partners are throughout the community. That's our nonprofit partners that'll be on this radio show here in probably about 20 minutes or so. But it's an incredibly important time. It's an incredibly busy time for us. And it was so rad to see those people come out and knock that out. I probably screwed up a bit of that stuffing of the packets, so please be warned. But thank you to those volunteers that came in, and for those that didn't, we will bribe you next year if you want to come help out.
Gotcha. Now, this may be from times past and not happening anymore, but do you still have like the loaned executives and all that program?
No.
Does that go on?
No.
How far behind time am I?
I know that they have those on Oahu for
Oh, they
Aloha
do.
United
Okay.
Way. We haven't had them since I've been here, which has been almost 5 years.
Okay.
So,
All right.
I'm
I am
always
behind the times.
I'm always open to learn and
Yeah.
see if we can try new
Exactly.
things. So loaned executive just means free labor in some way, form, or fashion. So I'm going to jot that note down.
Right.
yeah.
Because I think the push for those folks was that they kind of went into the various businesses that maybe they deal with and tried to talk about Maui United Way with the office manager or the HR person or whoever.
So we're always keen to learn and revisit those types of programs. I think there's something in that form or fashion that still takes place kind of in a not as a organized fashion, I would say, but we definitely have our volunteers and our board members and people that come in and actually help distribute the multitude of packets that are lining our hallway.
I got you. Well, you talk about 300 businesses. I mean, that's a lot here on Maui.
It's a good portion, Angela, right?
Yeah, it is. It's we're still looking for more companies that would love to have a workplace campaign. If anyone is interested, they can contact us. We can come in and we can have a representative from one of our agencies come in, talk about the wonderful work that they do with the program that we fund. And we can just get you started. And all you have to do is contact us, and we try and make it as easy as possible. We can do the ask for you. We'll just, talk to your employees and get everything rolling.
Are there some creative ways that the various companies encourage their employees to give? I mean, do they have incentive kind of things within the company?
There are a couple different agents or companies that have like a dress down Friday. So if they donate, say, $5 or $20, depending on if they want to dress down for a month, wear jeans every Friday, then that's how they do it that way. And there's also a couple companies that will have bring your fruit in from your, fruits and vegetables from your own garden, and then employees can buy that, and then that money goes, to the Maui United Way.
Interesting.
So a lot of different companies have some great ideas.
Yeah. I thought I had heard about some of that. I mean, my company is so small that, it's like, hello, we hardly have enough to play cards.
Yeah.
But I'll tell you what, even those small organizations and those I wouldn't even call them micro donations, but if they're bringing in $1 a pay period, that makes an impact.
Right.
And that's what we strive to do, is make sure that we can stretch that dollar as far as it can go, and make sure that it stays here on Maui as well.
Right.
That's something that we're really, really proud of.
And I that's an important point that I think a lot of people miss out on, and that is, okay, so it's $1 a week or $1 a paycheck, or $2 a month. I'll make it $5. What the heck is $10? So $10 a month is $120 a year, times, say you got 6 employees.
Yeah.
That's $720, just like that.
Yeah,
If you ask somebody for $720, that's asking a lot.
exactly.
But if you do it that way, it doesn't hurt at all.
And it, like I said, it makes a massive impact. And so for everybody out there listening as well, is, our partner agencies that we work with, run the spectrum. It's from hospice to, the Boys and Girls Club to Emua Family Services, who will be coming on the show later this afternoon. But the community is our partners that choose where that funding goes as well. So it's not just, hey, give us your money. It's, hey, be part of this journey and tell us where this needs to go.
Okay, so you've got the agencies that you partner with that are official partners because they've gone through the screening and so forth and so on and get money for certain programs. But then there's also the option for somebody to donate and say, I want it to go to such and such.
100%.
That's still correct?
100%. We really stand by where does our supporter want that support to go. And if they come to us and it's not something that one of our partners are doing, but we know somebody in the space, whether it's affordable housing or anything like that, we will absolutely direct them to where that money can be best invested.
Right. And I think that's what's cool about it, because a lot of times you look at the list and you go, Okay. Everybody's getting their fair share, so to speak, because most people don't specify.
Right.
But yet, I want my money to go to such and such.
They can do that. They can designate it to a specific charity or partner, even from outside of who we're currently working with. But they can also designate it to certain areas that we focus on, whether that's education, health, or kind of economic development as well.
Right.
Or, you know what, if you want to help animals, Maui Humane Society is another great organization, and they can direct them to there as well.
Right. Interesting. How long now has it been that health, education, and what's the other one? Financial?
Economic development.
Economic development have been the three key areas. That's been a while.
It's been a long while. We like to keep them in those categories because we've found that just from surveys that have been done, those are the three main categories that people need help in to have a good life. And so you have to have, education in the child, and then you have to have health to make sure that that child stays healthy and adults stay healthy, and then you have to have that income sustainability in order to make sure that all three of them go in together. And we just want to make sure that everybody has a chance at a good life, and so we'd like to keep everything in those three brackets in order to keep the whole ohana going on the, having a good life.
Right. Now, this last year, how was the fundraising? Did you hit your goal?
We did hit our goal. It might have been a little bit short of what we would have loved to have seen. But
you didn't tell us that. I mean, you told us what the goal was.
Well, we ensure that luckily enough that Maui United Way has had some strong support in years past that we were able to backfill that. Can we do that every year? No. So we do need to look at ways that we can improve our fundraising, how we can, better utilize the investments that we have, and make sure that $1 really does get stretched as far as it can go. What I've seen coming in new to Maui is that there is a closed system. There is limited resources. And do we move resources here to this organization and do that? Is that the best use? We don't know. So how can we bring in resources from outside of the island as well? So we're looking at every avenue we can to help not just the 30 plus partners that we have, but all the new nonprofits that are forming on Maui as well.
Right.
So it's always going to be an uphill battle. We all know that in this fundraising space, but we need to let everybody know that really every dollar does count. And we take that trust and that investment from our community very, very seriously, with a lot of responsibility.
And as I look over and as we talk about the different companies that are out there, and you talk about 300 packets, and I'm really stretching to think of 300 companies that have enough employees to really push this number. I mean, your goal is usually around $1 million a year, right?
Yeah, that's right where we're at.
And that's a lot of money.
It's a lot of money. We do have some generous supporters. We do look at grants that we can fill those gaps as well. But we also have some other programs that we fundraise for in addition to that. Our Tools for School program that just wrapped up. That, wow, I'm blown away. It's kind of grown exponentially and helped over 1,000 students.
Yep, over 1,200 backpacks were given out to the children in need. And in the years past, we've just done, the school supplies, and we would try and, give everybody the supplies that they needed. And we switched it to backpacks last year, and it did such a great job that we continued it again this year. And it was a need of 800 last year, and the need went up to 1,200 this year, and we were able to supply 100% of the need, which was awesome. So we want to thank everybody out there for donating and everything that they did to support this.
Now, the list of folks that they were giving these backpacks to, does that come from the partner agencies?
It does, and that's what we get to do. We're not boots on the ground from my old military days, but we do have a kind of a 30,000-foot view of what's taking place. So we worked with Salvation Army. We worked with some of our partners that are dealing directly with their clients to where it's getting in the hands that need it most.
Right. And this was what age group?
It's from kindergarten on up to 18.
Really?
So, yeah.
Oh, wow.
So we do all grades.
1,200 students. And I think I saw where you had like 17 left, or 17 more backpacks than the 1,200 you were hoping for.
It was like 12, 17. Yeah,
we definitely scrapping.
We have a head start for next year.
There you go. That's great. On that note, we're going to take a short break, and we'll be right back.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in Central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with Maui's nonprofit executive directors and staff to find out what's happening in their world. And today we started off the show talking with the folks from Maui United Way. Angela?
Yes, Angela Stewart,
Who is?
the Campaign and Projects Coordinator.
What a title. You know, it sounds like she does all the work.
I do.
Don't tell anybody.
Because that's what you're all about.
Yes, that is it. Yeah, I mean, the team there has just done an amazing job, and the fact that I've come in at a time where we're kicking off this campaign, which kicks off, well, we kind of kicked it off last week, but
Yeah.
Officially.
Little early, but
Yeah.
officially September 1st, yes.
So now that runs till when?
Till April 30th.
Okay.
The campaign packets that we give out to the companies, we usually try and get them back by October 31st, but we do have the campaign that runs all the way until April 30th.
Okay, so we'll probably have you on the show at least once or twice while the campaign's still going on.
I hope so.
Yes.
I
To
hope you'll
remind
have us
people.
back.
Gotcha. And that was the voice of Nicholas Winfrey, who's the new president and chief professional officer for Maui United Way.
No, that's a mouthful.
That's a mouthful.
Yeah, but you don't do anything. It's a title.
I know.
Yeah.
Don't tell anybody.
Oh, well, okay. Maybe the secret's out. Somebody might be listening to the show, you know.
I will gladly, you know what, I work on the premise, if I win the lottery, we want somebody to step in and be able to take over exactly where we're at. So
That's not what I expected him to say. I expected him to say he was going to sign the check over to Angela.
There you go.
That too. Well, you know, we do have Angela actually involved in one of United Way Worldwide's leadership programs as well. So I think this is a bit of a tangent, but I will kind of commend her and congratulate her on being accepted into that space. And,
Cool.
you know, I talked about earlier about bringing, you know, outside revenue and resources onto the island. That's not necessarily just dollars. I think that's training our staff to be better leaders in the community and think about how we can do things a little bit better. Our goal is to be out of business. Not that, you know, we run out of money, but that there's no longer a need for us.
That's all of us in the nonprofit world are that, right?
We
keep
those
looking for that day. you
those
know?
rose-colored glasses keep staying on, and that altruism never ends, right?
And, you know, sorry to say, in most cases, it's exactly the opposite.
It's
There's more and more need out there.
It's unfortunate. And I think that's what you're seeing with more and more nonprofits be created on Maui. And as an update for us is we are actually improving and automating and opening up our partnership program coming up early in the year next year as well. So we are going to be looking at making it easier for smaller nonprofits that might not have the resources to do the full application process with us to have a more streamlined way of doing that.
Ah, gotcha.
Yeah.
Interesting.
Opening up a can of worms there. Don't tell anybody.
Yeah, that just means you've got to raise the limit as what you're looking for to raise every year, because you don't want to cut back on those who are
100%, but we also don't want to, you know, we don't want people to be reliant on that one donation every year. We want people to get those programs going and get them going in perpetuity and grow those as well. So it's always going to be an uphill battle of finding those resources, but yeah, that's why we're here. That's why the grays keep popping up.
Gotcha. Last comments. Angela, you want to say anything or remind us about anything we already said?
Nope, just we've got our parade coming up for the county fair, and so that's something that we always look forward to. We work with our partner agencies and their clients, and we usually have around 300 people that walk with us in the fair. So look for us out there at the parade. Beforehand, we'll be in bright orange shirts. Just out there supporting Maui United Way.
Cool.
And if you want to get involved with our campaign, just give us a call. We'll be happy to come out and get you set up. It's really easy.
Phone number is?
Our number is 808-244-8787.
And your website is?
www.mauiunitedway.org. Or you can email me at angela@mauiunitedway.org.
No excuse for not catching up with it, is there?
There it is. She's laid it out.
We'll wait for that. No, we don't wait for the phone to ring. We anticipate the phone ringing.
Yes, we do. If not, we make the calls.
There you go. Last thoughts from you, Nick?
Just want to say thank you to everybody in the community for all that they have done in the multitude of decades that Maui United Way has been part of this community. So we're really, really lucky to be such an integral part and have so many amazing partners, including you. So thank you.
Oh, hey, our pleasure. Our pleasure. Maui Nonprofit Directors is all about that.
I agree. And it's amazing coming in from a corporate mindset of everybody, hey, I got to do this. This is our secret. And coming to organizations where it's like, hey, why don't we all just do this together? It's definitely a good feeling.
Right. Yeah, and it's an exceptional situation. No other island has a Maui Nonprofit. Well, Maui, but no other nonprofit directors association to share information and to help educate everybody. You get a lot more turnover than people realize.
It can get a bit stressful, yeah?
Really?
No.
Oh, come on.
No.
He says after 4 months on the whatever.
Good warm and fuzzies. We do it for the warm and
There you
fuzzies.
go.
That's what we do it for.
We do it for tomorrow.
Yeah, 100%.
It's all about tomorrow.
Yeah. How can we make it better?
And I see that especially because everything we do is long term. And it's, as you build affordable housing, it's handing the keys to the new owners. To watching the kid run up the steps and say, "This is my room."
Yes, I
Think about that long-term impact.
Yeah. Anyway, thank you so very much for
Thank
joining
you.
us, and good luck with the campaign. And I'm sure we'll be seeing you soon.
Aloha.
Okay, good to
Thank
see you again, Angela.
Good to see you too.
Okay, take care. We're going to shift gears here now, and we're going to talk to some folks about a new program that is being kicked off. I guess it actually kicks off November 1st. Is that right? That's when the open enrollment starts.
Yes, correct.
Yeah. Okay. We've got, let's see, who all do we have here? We have Genevieve Durego, who is what is your title?
Eligibility specialist from a
Oh, I like that title. Eligibility specialist. Woo, okay. And we have Paul, is it Thome? Tome. What's the H doing in there?
It's a derivative of Thomas.
Gotcha.
Somebody got fancy.
Okay. So we have Paul Tome, who is from the Big Island.
Yes, from Hilo.
What is it? I saw the other day people are supposed to not say Big Island anymore. It's Hawaii Island. Has that hit in Hawaii or on the Big Island?
We haven't got that memo yet.
Oh, you didn't? I'm sitting there going, well, but that's going to be so confusing if we switch that, because every island is Hawaii Island, right? I mean, if you think about it, it's been a long time trying to get used to calling Oahu Honolulu Island, and yet everybody's using it, right? Oahu's gotten lost in the whole thing. Anyway, we're not here to talk about that. Keisha, what are you here for?
I am actually here. I work for the State of Hawaii MedQuest Division. I work for the Healthcare Outreach Branch. So starting actually effective July 1st, the Big Island Kukua Services Program, Bixby, in partnership with MedQuest, started the Maui Kukua Services. So it was going on throughout the state of Hawaii. We didn't specifically have anybody for Maui County, just myself, and I work for the state of Hawaii. So we now have individuals dedicated specifically to help the community to sign up for MedQuest, otherwise known as Medicaid, and also healthcare.gov. Some people have known it as the Affordable Care Act or Obamacare. So we now have, right now we currently have 5 individuals who are contracted on Maui, specifically on Maui, to service Maui, Molokai, and Lanai, to signing up for medical.
Right. Okay. So now is the focus, is this on getting the youth youth signed up, or families, or who are we signing up?
It's actually any community member, any resident of Maui County, or throughout the state of Hawaii. There's other agencies throughout the state that can also assist with them. But anybody who's lost coverage, to see if they qualify for Medicaid or for healthcare.gov.
I see. Okay. And is this MedQuest? Now, when people say I'm on Quest, that's it.
Yeah, so MedQuest is, the shortened version is Quest, but it's
Yeah.
MedQuest,
Oh,
or
okay.
Medicaid.
And what are the criteria for being able to get that coverage?
So there is an income limit, but basically you have to be a resident of the state of Hawaii. So have some form of identification, showing that your address is within the state of Hawaii.
She's the one that said
Yeah.
I don't want to talk, right? And I'm pointing all my questions at her. Should I switch them over to Genevieve so she can jump in?
I think, looking at this program and what made me excited about it was giving our county a much larger reach. If you've ever had to go out into the community and look for assistance, how long are the lines? What time are we, what time are we stepping to the plate to stand in line to get services? So for Maui to look at embracing this and saying, how can we be a bigger support here, and let's get a few more bodies within this program and kind of, lay it out there so that there's a bigger reach, so that we're really looking ahead to our future and making sure that we're meeting people's healthcare needs and being supportive in that way, and raising us all up together so that everybody is out there thriving, And so by having this program available and having more bodies able to help with the process of getting health insurance, that is key, so that we don't have that struggle. And we can continue to do all that we juggle. So yeah, I kind of think that.
Cool. That's. I think that's good coverage of it. Do we have a lot of folks who are uninsured? Do you have any numbers, percentages, or?
Numbers not offhand. When the Affordable Care Act came on board in 2013 was the first open enrollment for a start date of January of 2014. There were a lot of people who are uninsured. We see less and less of that now. However, that has kind of since gone away, and there are people who are still uninsured. So we're here to help people who are uninsured and those who maybe can't afford the insurance, whether they have to pay out of pocket, whether they're self-employed, or, maybe they have coverage through their employer, but their family doesn't. So basically, we're here to help everybody to see what they qualify for. We don't turn anybody away. We are here to help them. And if we can help them through our programs, it's definitely giving them the right avenues to go to so that they can get the help.
I see. Yeah. Okay. And this is you don't have to be working. Well, you're working with kids in many cases. I like the comment you made about the parents might be covered with the jobs they have, but it's that extra that they'd have to pay out for the coverage for their children.
Correct.
And I'm assuming that this is a much lower cost insurance than the dependent insurance from Kaiser and HMSA and
Correct.
so forth.
Correct. And I think with the Kukua program, if I may, we want to make sure that in going out into the community that we are, Hawaii is such a big melting pot, right? So we want to make sure that we're addressing the kofa population, that we're going out into the homeless communities and supporting that such a large population with farm workers and service workers. Tomorrow I'll be doing an event over at the Hyatt, closed event but nonetheless, making sure that the employees that are, casual, right? How many
Right.
times, are there job postings for casual employees?
Right.
Well, who's supporting their situation, for insurance?
Sure.
So, along with the general population, it's important to make sure that we're really navigating everybody within that melting pot.
Right. Interesting. So over getting, excuse me, getting back to the Big Island now. Early before the show, we kind of talked about how this grant all happened. The state issues the grant to you on the Big Island, and then you subcontracted with Imua Family Services. Is that right, here on Maui?
Yeah, that's correct. What we did was we reached out to Maui because we identified there was an existing program. So we came to Maui and met with several nonprofits, and to be fair, we gave them like a week's notice before the end of the contract. So big up to these nonprofits that stepped up and got the work done. I anticipated being a very good partnership for this upcoming year.
Right. So this is a 1-year contract?
It is a 1-year contract starting July 1st of this year, going until June 30th of next year, so 2020,
Okay.
with a possible extension of
Okay.
another year. And I do want to mention, not only is Imua Family Services a part of this grant or as a subcontractor, Malami Keola Health Center right here in Wailuku, right across the street from where we're at, they also have individuals. They're also a subcontractor of this grant, so they have
okay.
individuals that can assist with applications as well.
Okay. And that makes sense because that's part of their mission as well.
Right, correct.
And that assists them in the long run. So that's a very good benefit for them to work on.
Yeah.
So now, at Imua, you're opening up territory to the community.
Correct.
They don't have to be Imua clients.
Oh, definitely not.
Yeah.
This is the public at large.
Right.
Our efforts are not just within Maui, but looking at Lanai and Molokai.
Gotcha.
And directly hitting Kihei and Lahaina and Upcountry and Paia and Hana. I mean, we want to. We're not showing up for no reason. We want to be dedicated in our efforts of making sure that we're helping people and planning for our future and planning that they're getting the best care and supporting them, holding their hand, walking that course with them.
Gotcha. Now, are there any doctors or any medical facilities that would not accept MediQuest or MedQuest or what you're selling? Let's put it that way. Do we know offhand?
Not offhand. Most community health centers, except MedQuest, I know Maui Medical Group here in Wailuku, and they have locations in Kahului, Lahaina, Kihei, and Pukalani as well. So basically, the individual who does qualify and is approved for MedQuest would need to contact their specific physician or clinic to see if they accept MedQuest is an overall branch, and they have plans with HMSA, Kaiser Quest. They also have plans with Aloha and Ohana Health plans as well. So if you're approved for Quest, you do have your choice of health plan, and that you can choose at the start of enrollment, or if during plan change, which starts on October 1st and goes until October 31st each year.
Okay, so now's the time.
Yeah,
to be
so
thinking
we're
about it.
gearing up for that. If you like to stay with the same health plan, you really don't have to do anything. If you'd like to change, that's when the change plan is. And that's usually when Kaiser actually opens up their enrollment period. Usually, unless you're a former Kaiser member, they have a cap on how many people they accept.
Oh, I see.
Yeah, so.
Interesting.
Yeah.
Are there any reasons that somebody would be turned down for it, assuming they meet the income eligibility? I mean, obviously they cover all pre-existing conditions and things like that.
Correct.
But-
There really is no reason unless the individual decides that they don't want.
It would be their decision.
Yeah, it would be their decision. If they're deemed eligible, they would have their choice of health plan, and they would be notified.
I see.
Yeah.
Okay. Their choice.
their choice. So we don't endorse any specific plan. It's
Right.
up to them. They are automatically enrolled into a health plan at the very beginning. However, if we know when we're doing outreach or we're signing somebody up, if they are determined eligible for MedQuest, they can let us know, hey, I've had HMSA from my employer, I want to continue with HMSA. We can call the call center and have that information relayed to them so that they're enrolled into HMSA versus the system enrolling them in Aloha or Kaiser or Ohana, and vice versa for all the other plans.
So if they don't have any particular choice, there's options that might
Correct.
be presented to them.
Correct.
I gotcha. On that note, we have to take a short break, and we'll be right back.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in Central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with our nonprofit executive directors and staff to find out what's going on in their world. And today we're talking with some folks from, Imua Family Services is the kind of the title sponsor of this particular product that we're talking about. Genevieve Dorego is with them, and Paul Tomei is from the Big Island, where the grant originates. Now, how have you had this grant for a while, or is this the first year for you too?
No, we've had managed the grant for the last 3 years.
Oh, okay.
And this is our first new
Expansion.
contract. Yeah.
Okay. Have you seen some pretty dramatic results?
Yeah. So in our numbers, we always show an increase every year. So we're covering more and more people. We're making better networks, getting the word out, and we wanted to collaborate with Maui and see if we can replicate some of that back here.
Right. Great. Now, once somebody gets on, they don't want to get dropped. Because I mean, is there a kind of a stigma to that if you don't pay your bill or whatever and get dropped?
It happens.
Yeah. But you can get back in if you have to, or not.
Depending on the situation, most likely, depending on what they get enrolled in and for the reason it's dropped, there's a whole bunch of variables.
I'm sure, yeah. But for the most part, they're just thrilled to have it.
For the most part,
available.
yes. Some peace of mind.
Yeah,
that.
right. Are there various plans as far as coverages and things like that? I mean, is it a multiple choice kind of thing? What coverage do you want, or what do you need, or that kind of thing, or what do they get into?
Yeah, definitely. On the MedQuest side, as Keisha said, there's providers under MedQuest. Basically, most MedQuest providers are basically the same. It's how they offer, but in essence, it's the same coverage, and it depends on the doctors if they accept it or not. We see that on the Big Island. With the Affordable Care Act, we normally have 2 carriers, which would be HMSA and Kaiser, and within that, there's tiers, or they call them metal levels, and of course, you have the top level. One is a high amount of deductible. One is no deductible. So the choices can be a little bit overwhelming. Yeah.
Right. So it's good to have someone like Genevieve to help you through
Correct. I think for the most part, the application process is probably the most intimidating, and it probably is the reason why a lot of people don't get coverage, is because once they try to do the paperwork, they answer the questions wrong, and they don't get the result that they should get, and so that's why it's important for us to have Kokua in the community to help with that process.
Right, right. Because if they get frustrated, they just put it away.
Well, the system is there, right? The system was built, and as a single mom, whenever I've had to, get help of how to do things, it very much feels like, filling out taxes, for goodness sakes. A, B, go to Z, back to 1, 2, and 3, and divide that. But, so to have somebody that's caring and understanding and going to walk you through this process, to look at the application itself, might seem very simple to some, but just to know that you've got the support there of somebody to help walk you through that process, it changes the whole dynamics around what we need to do to build, a better legacy for our children. Like, walk the path. Let's teach by living a life of example. And so that, here in Hawaii as a state is helping one another. And so I'm happy to be part of that.
That's great. So you mentioned the levels, high deductibles, low deductibles, whatever. Obviously, the less the deductible, the more expensive the plan is.
It could be. Depending on the situation, and it's different for each family, each individual, they qualify sometimes for things called cost share reductions. Those are some of the things that we sit down with our consumers and we kind of explain those things to them. There's tax credits, there's a bunch of different things that at the end of the application will determine what comes out of pocket.
I see. Okay,
Yeah.
so there's the variables, can be offset by the variables in the family situation or for the applicant. It's not clear cut that because you picked this, here's going to be your price. There's some other pieces that go in it. Like you talked about going to A to B down to Z and back to number 1. And I for all of us, that's confusing. So I
Right.
can't imagine someone who's not familiar with insurance or the health issues, because there are some things out there that, for many years there were a lot of things that wouldn't get covered.
Mm-hmm.
Now we're covering practically everything, I think, aren't we? And certainly the past situation where you've got a pre-existing condition is a big one, and why most people want insurance at whatever cost. But if there's a less expensive way to get it,
Right.
it's great that there's somebody like you out there who can help them see where that is and how to do that.
Because you're dealing with the confusion, you're dealing with the anxiety of it, you factor in hardships of homelessness, living in shelters, that sort of thing. Those are all going to be things that create, blocks.
Right,
And so how can we lessen those blocks?
right.
And so let's grow the amount of people that's there to utilize these programs that have been put in place to help us to that next step.
So how do we get the word out to the community in general? What we're doing it on the show here, and we know we've got at least 4 listeners. No. what was the latest number we were talking about? Several thousands of listeners out there that are eavesdropping on our conversation here. But are you going to be going out to different groups, to different club luncheons or community meetings and things?
Yes, the outreach part, getting out there, getting involved with the community, looking for different events that are going on that have, a sizable number, planning myself, if that means myself and the team at local libraries, different mixers that's happening. Where would it be most beneficial to reach the population where there's going to be larger groups, a larger reach? Yeah. And as you're talking, I'm thinking there's no group that would be inappropriate, because within any group, everybody there might have insurance, but they certainly know somebody who doesn't. And if they can pass the word on to them that, hey, here, go talk to her, she can help you. That's what we're all about, is sharing the information. Isn't that true? Yeah. Yeah, just, and, leaning in, to the person that's watching your kid. You know somebody knows somebody. And with that being said, now they've got, through Malama here, through Imua Family Services, they have areas that they can just pick up the phone and talk to their local neighbor or whoever that may be and get that help of at least posing the questions and trying to navigate what is the next step of this.
Right.
Yeah.
Right. I think that's the important thing. And it's one thing to call a state office and
Correct.
say, hey, what's this Quest thing? But it's another thing to have somebody coming from Imua to your meeting or to meet with at your office or whatever and say, what is this all about? How can I get it? I don't have much money. Well, that's what it's all about.
And so, if it's, something within the community that would, I'm sure, like to have us come out and show up, if they're having an event, I encourage, the outreach to me directly. And then we can look at what that is and look at, coming and meeting and talking and just getting that started, getting that ball rolling.
And how can they get a hold of you, Genevieve?
Well, right there at Imua Family Services, that number is 808-244-7467, extension 704. Also, my email is, should I lay that out there?
Sure, sure, do it.
Is G for Genevieve, and then Derego, DEREGO, at imuafamilyservices.org.
Terrific. So there's no reason anybody can't get a hold of her now.
I'm ready.
She's there, 244-7467, extension 704. I can't tell you what it means to me to realize that someone like you is going to be going out there and talking about this, because I think that there's the people I know who have tried to apply for some of these things. It's just they feel like they're getting lost in the minutia of the whole thing.
Right.
And I think you're going to take them right straight through that to what's going to work for them.
It's important.
Yeah. Without them just walking out of there going, what have I done?
Right.
Am I right? Is that what we're talking about, Paul?
Yeah,
I mean,
you're
you
correct
see
in
that?
your assessment. I see that a lot. That, to me, is one of the biggest barriers for people getting help, is that they just kind of throw their hands up and
Maybe next year. I can't deal with it this year, or something like that. But then you don't have coverage. I mean, I can't imagine. When as I go to the doctor for something and I get this report back from my insurance company, what the charge was originally and what it was reduced by because of their contract, and then my $10 is like, oh my gosh, I can't believe that the medical services are so expensive. And I think, how does somebody do that without insurance? And more importantly, they probably don't do it because they don't go to the doctor because they don't have the money. And then they end up being in the emergency room at multiple times the cost.
yeah, that is one of the big pushes too, is to make sure that we cover people with adequate insurance so we can avoid the ER situation.
Right. I mean, it's just, it's mind-boggling.
Mm-hmm.
I mean, and I'm not saying that it doesn't cost that to do it, because medical services cost money. People, equipment, place, you name it. But it's just, like I said, as I look at those numbers, I think, my gosh, it seems backwards, It seems like the cost should be less because I have medical insurance. But if you don't have medical insurance, you pay the full price. Or get charged it. Anyway,
Yeah.
right?
You can't afford that.
Yeah. I mean,
No.
it's just, and so you wait until it becomes a serious issue and end up in the ER where they have to accept you.
And so, hence, the program, Hawaii or Maui, uninsured or underinsured.
Right.
That's what we're doing.
We gotta get these folks insured,
Yes.
one way or another. Keisha, how long have you been doing this?
So this is actually so I took a break for a little bit, but overall, collectively, I've been there almost 7 years.
Is it really?
Yeah. It's been
I
that
remember,
long.
I remember when you went to the state, and I thought, what is she doing?
But I love my job, and I'm definitely here to help. It's kind of only been me since I came back about 4 years ago. So I am so looking forward to the help. Like you had mentioned, it's a struggle trying to reach the entire community and just being one person. So like Genevieve said, give her a call. You can also give me a call. My telephone number is 808-341-4030. That's 808-341-4030. And my email address is Sakugawa, SAKUGAWA @dhs.hawaii.gov. And we'd love to come and talk stories with you if you have events that you'd like us to participate in. And it's not only for community events, but maybe you have employees. For example, we're going to be going up to Kula Hospital and also down here at Maui Memorial when they have their employee health fair. And we'll have a booth there, so if you want to come and chat with us or have us come and talk to your employees, uninsured or underinsured, we'd be more than happy to come down and talk with you folks.
Very good. Last thoughts. We've got about a minute here. Come on, quick. Paul,
Last
Paul,
thoughts.
Genevieve, whoever.
Last thoughts are definitely, if somebody's had a baby recently, just moved to Hawaii, change in household income, recently released from incarceration. We want to talk to the KOFA population, really. We are here taking a stance, offering our help, our kukua.
Very good. Paul, thank you. It's 4 years, you say, and you've seen success.
Yes, our participation has gone up.
Yeah, that's great. And now you're sharing it with us here on Maui and Lanai and Molokai. Keisha, good to see you again.
Nice to meet you.
Genevieve, Paul, nice to meet you. Good luck with your challenge here. And I hope you have more good days than bad. It's a tough one sometimes. Yeah, starting something new out there. Maui Nonprofit Notes is sponsored as a community service by Pacific Source, the builder's choice. Please give them a call at 986-0380 or stop by their showroom in the Waikapu Bayshard on East Oahe Way to see how they can help you with your building project. Pacific Source has been our sponsor from day one, and we want to thank them for their ongoing support these 10 years. And to you, our listeners, we thank you for the response our agencies get from you regarding the activities that we talk about on this program. The Maui Nonprofit Directors Association's mission is to provide personal and professional support to nonprofit executive directors, their organizations, and the community of Maui. Please visit our website at mauinonprofit.org for a list of member agencies. And if you see one there you want to learn more about, click on their name and it'll take you directly to their website for more information. Today we visited with the folks from Maui United Way and the folks from, well, let's see, where from? You guys are from 3 different places. Imua Family Services, the state of Hawaii, and what's the organization you were?
High Half Big Island.
High Half, that stands for?
Hawaii Island AIDS Foundation.
Ah, cool. Very good. And talked about the MedQuest program. Kokua is what you're going with, right? Program that is brand new for Imua. And be sure and get a hold of Genevieve at 244-7467, extension 704 to find out more about it. We want to thank everybody for tuning in. Don't forget to join us again next week right here, same time, same place, when we'll feature 2 more member agencies of the Maui Nonprofit Directors Association. Until then, I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host. Have a great weekend, everybody. Aloha.